I'll ask you a question too, and this is a little bit off topic, but it's still dentistry related. Um, like I've never been afraid to go to the dentist. I have no. I had a really great dentist, Dr. Joy in San Francisco. I had her for like 16 years, love her, and I liked going to dentists. I mean, I had no problem with them. What do you tell people who are afraid to go to the dentist? Like, what are a couple of things you tell them to get them to go to the dentist?
Yeah, well, I mean, generally, when people know they need dental work, it's in the back of their head.
Yeah.
Yeah, so they need to find a dentist that they feel comfortable with, that they trust, that they know is going to do a good job for them. And if they're really, really scared, they could be sedated.
Okay, that's good to know.
Yeah, we love sedating patients. It's nice to do that, knock them out so I can focus on what I'm doing. There's two ways to sedate a patient.
Okay.
We could do an oral sedated pill. It's like a
pill.
form of Valium.
Okay.
It's fast acting, and it actually knocks the patient out. And it has a half-life of 2 or 3 hours. They
Wow.
wake up and they can't remember much of what happened.
Yeah.
The other way is we have the doctors that roam around Beverly Hills,
Yes.
and they call them the Candy Man, and they come and they do a little IV,
Okay.
and it's propofol, sort of the Michael Jackson
Oh yeah,
propofol.
but obviously lighter dose.
Yeah,
Yes.
and lighter dose is very safe,
Yeah.
and because when it's monitored by a doctor who knows what he's doing,
Right.
and so it actually wears off like really quickly. So like when we're working, I'll say to the anesthesiologist, I need to take a bite in like 3 to 5 minutes. He says, thank you. And then within 5 minutes, the patient's closing and
Okay.
listening to me.
Okay.
So that's one recommendation. The other recommendation is try to group the dentistry all into like big things. Instead of just doing like one side at a time or
yeah, okay.
one quadrant, you do the whole mouth. So you group everything. We spend like 3-4 hours on one patient,
Okay.
and we just get it all done.
Wow.
So yeah, that's why I call it revitalize your smile versus revitalize your mouth. The difference is when I'm revitalizing a mouth, I'm actually working on all the teeth at one time. I'm doing like the bite, I'm doing the smile, I'm fixing all the old dentistry,
Right.
modernizing everything, making everything look really pretty, and I do it all in one sitting. It takes like around 4 hours, 5 hours, and you just sit there and not uninterrupted like a doctor who's doing surgery.
Yeah.
Not being interrupted. I'm not running from room to room.
Wow.
It's not that kind of dentistry.
Yeah.
It's really one-on-one dentistry
Wow.
where you just have, and that's really good for patients that are nervous for the dentist because then they're done. Then they just
That's
get their
true.
teeth cleaning.
Because you're actually saying something that I've been told the opposite. Oh, you just do one this, and you just use this side 1 week, and do it. So if it hurts, you don't worry. You can, and then like, but no, you go back and you remember the experience. So
Exactly.
you don't want to go back for the second time.
Dentistry, listen, in medicine, what medical doctor is going to do the whole procedure with local anesthetic? I mean,
Right.
let's be honest.
Right.
For some reason, dentistry does all their procedures
Yeah.
with local anesthetic. It does not have to be that way.
Yeah.
You go to an ENT doctor, he does anything on the tonsils,
Right.
they knock you out.
Right.
We would do the same in dentistry, so we offer that for our patients
Yeah.
in Beverly Hills, definitely.
I took your advice before I knew you, but I had all 4 of my wisdom teeth pulled out at once.
Right.
Because I had a friend who did 2 and 2, and it was horrible.
Yeah, that's
I was
ridiculous.
like taking all 4 of them. Give me the drugs afterwards, I'll be fine. But I like that. That was my thing, was just get it all done at once. And it's one trip anyway. We're busy
One
people.
trip.
One trip, you're done.
And one healing experience. All 4 heal at the same pace at the same time, and it's like you're done.
That's a good point to bring up too. That just people think, well, I want to do a little bit at a time here. Like, no, get it all done at once. It won't be that much more.
It's a win. It's a win-win.
Yeah.
It's a win for the patient because they're done and they don't have any more dentistry. It's a win for the dentist because he's doing a lot of dentistry,
Yeah.
and he's making money.
Yeah.
And so it's a win-win instead of just one. To set a room up, and for every patient, we have to let it sit. We have to put disinfectants everywhere. It's hard every time we change a room over. So it's way efficient for a dentist to do more on a patient than less.